Our guest today is Ms. Consolata Opiyo, the representative of the Global Network of Young People Living with HIV. Please tell us a little bit about your work.
I am a board member for the Global Network of Young People Living with HIV. And what we do is that we work with young people who are living with HIV so that they can know their rights, they can know their issues as young people living with HIV, they can know where they're supposed to get the healthcare services, and they can also advocate to ensure that other young people who are in the rural settings are able to get the services that they require as young people living with HIV.
As you've been working a lot on HIV, could you give us some pointers on how to ensure that the adolescents living with HIV are not left behind?
What I can add in that is that adolescents living with HIV, first of all, they do not know about organizations of young people who are living with HIV. So it is better to look for them where they are usually found, whether it's the social media platforms or in the rural settings. But you should use the method of sensitizing them and awareness creation using these platforms. And then when you get them to understand what HIV is all about, then you can also include them in your work and in your own organizations.
You are also a big supporter of the empowerment of young girls and women. What is the importance of girls to the future of the world, and what are some ways to empower them?
As you know, this world would not exist really. We wouldn't even be here if women were not involved. And girls are the future of this world because they're the ones who are giving birth to the new generation of young people, the new generation of children who will be future leaders. And if young girls and young women are dying right now because of many issues, then we should just say that our generation is gone. It is important for girls to be empowered so that they can also empower the community. It is usually said in our African tradition that if you educate a girl, you educate an entire community. But if you educate a man, you educate an individual. So girls' empowerment and girls' education is very important because women are a very strong character for human beings, and they are very strong for their own families. You find in Africa, for example, that a lot of women are single mothers and they go to school, they work, and they still provide for their children. So it is very important for them, for us all, to ensure that girls are educated and young women and girls are empowered.
As we are currently at the 66th General Assembly of International Federation of Medical Student Associations in Tanzania, Arusha, what do you believe is the medical students' role in tackling HIV epidemic?
I believe the medical students' role in this is that they are the future doctors, you know, and with if their perspectives in how people living with HIV, for example, is involved, or in how human beings are supposed to be treated, if their perspective is changed, then I believe a lot of people will be going to health, medical facilities, and then we'll be able to maybe end AIDS by 2030. And also we won't have a lot of issues that young people are dying because of one thing or another, because we'll have a group of medical students who understand the mental issues, the psychosocial issues for these young people, and how these young people are supposed to be treated, the human rights-based approach that they can use, not just to see the disease itself, but to see the humanity in the young people and in the sick people who go to the clinics and the hospitals.
What are the main pillars of comprehensive HIV education in medical curriculum?
We have age-appropriate documentation, because most of the time you realize the documents that are shared, the CSE documents that are shared, are really not age appropriate because youngsters do not understand what it's all about. What the language that is also used is very important, because when, for example, if you use a medical term in a book where an adolescent is reading who is not a medical student, that will not help that student, that young person at all. So it should be also, the language should be appropriate for the youngsters at the time. You also have, it should be comprehensive. When you go to some hospitals, sometimes the information you get from the hospital and the information you get from the booklet are two completely different things. So the information should be a comprehensive information that is true, that is real, and that is actually evidence-based. The third one is it should be culturally sensitive. It depends on the region that we all come from, whether you're coming from the US, from Africa, whether it's Southern Africa, Central Africa, or Southern America. It depends with whichever region you're coming from. it should be cultural sensitive, and then we have it should be socially acceptable. You can't just write something in the CSC documentation that the church does not agree with or the community does not agree with. It should be something that is accepted by everybody, the youngsters, their parents, and the religious leaders. And then the last one should be psychosocial support. It should bring about the basis of psychosocial support. So I feel those are the pillars of comprehensive sexual education.
And last question, could you give a few words of wisdom for the medical students in Lithuania?
I love the fact that they chose the profession of medical students. They chose the profession of being medical, practitioners in future, because having young people currently choose to be a medical practitioner is not easy. Many people will go for the easiest, maybe communication, or they will choose to be something else, but not choose something that includes mathematics or science. But they have chosen this, meaning they want to be medical practitioners in future. So they should give their best in what they are doing. They should do it in the human perspective platform. They should love each other and love the people they are treating. And when they love their job, I'm sure they will do a good job with the other people who are sick. They should appreciate each other and appreciate their own clients and patients. Thank you.
Thank you.
Thank you.